Awesome, thanks so much. So we're going to go ahead and get started with our Action August webinar. So today we're going to go over some of the NAC resources, National Association of Community Health Center resources for National Health Center Week, how to do things like staff engagement and social media advocacy. So we're really excited to talk about all of these. And like we said, there's question answers at the end. As you can see on the right, you'll see your GoToWebinar control panel. So if you need to dial in for your access code, your audio pin, it should pop up if you switch to phone call. In addition, there is a question box and a chat box, so feel free to use any of those to ask questions. We do have a formal Q&A at the end, but if it makes sense with the presenter, we can always include that. So real quickly, this is one of the AppShow member webinar series. So this was launched in March, and it's an ongoing member benefit for AppShow members. We do about 2 webinars a month, one focused on advocacy skills and one on a policy background. So some examples in April, we talked about some of the emerging issues in payment reform as a policy background, and then talked about an advocacy skill set of storytelling to influence policymakers. In May, we talked about the appropriations process, which is the federal funding process. And then we also talked about how to use health research for evidence-based advocacy, so 2 different elements of influencing policy members. So that's all to say that as we talk about the various things you can talk about during National Health Center Week, we also have archived of these different webinars about some of the top AppShow issues. So we can talk with you about how to access those if those are things you also want to utilize. So why are we talking about National Health Center Week on this webinar? So as you know, National Health Center Week is an annual event. It's got about over 1,700 local events and 35 million Twitter impressions. And many health centers are able to channel staff, patient, and leadership energy into health centers, contests, and other events. This year, it'll be August 13th to 19th, which is actually in the middle of Congress's in-district period. And what that means, again, is senators, congressmen, congresswomen spend 5 weeks in their district meeting with their constituents. So they're supposed to be listening the whole time. They're supposed to be talking to folks. And this is a perfect time to talk to them. So last year, over 80 members of Congress visited health centers during National Health Center Week, and hundreds of state and local officials participated as well. This year, this August, we actually anticipate ongoing legislation impacting AppShow member priorities to be before Congress in that late July and early September time. So that's a really good time to talk to them about these issues. These include things like the primary care cliff, CHIP funding extension, and federal appropriations for FY18, which means federal money coming in October 1st, 2017. So this is a primary, really good time to take this energy of staff, patient, and leadership and turn it into some advocacy and policy action. So with that, I'm going to pass it over to Alex, who's going to talk about some of the different resources that NAC has around National Health Center Week.
Great, thanks so much, Heather, and thank you all for being on the webinar today. I think this is such an important topic, and with everything that's going on right now in the policy environment and all of our advocacy asks right now and the work you guys are doing back in your communities, I think Health Center Week is both, one, a nice opportunity to kind of focus on the positives of what's going on right in the healthcare system and what you know, the amazing work you guys do, to be able to really showcase that in a positive way, but it also really helps support our advocacy asks. And so I'm gonna walk through a little bit of like what we generally recommend for health centers to do during National Health Center Week, how you can really best leverage the week to promote your health center and then help add to sort of the national voice for health centers. And then we'll talk very briefly about like what, you know, advocacy components you guys can expect probably this year. So, sorry, Heather, can you scroll my slide or tell me how to do it? Awesome, thanks. So I have like 5 basic steps to Health Center Week success that I'll go through pretty quickly. Let's go to the next slide. So the first one is start your planning early, and I would say if you haven't already started planning for Health Center Week, it's not too late. It's okay. You can still have an amazing celebration and a great week with limited planning, but the earlier the better. You're just making it easier on yourself. And so some of you guys might know, we do our National Health Center Week kickoff webinar usually every May in the early to mid-May, and that's when we really say, hey, like you might want to start planning your events. But just because it's late June doesn't mean it's too late. There's still some fun stuff you guys can do. And I would say something we've done in the past couple of years that's pretty new is to have focus days or theme days for each day of the week, which kind of help you sort of, well, we hope it helps you to kind of focus on a particular type of event or a particular population. And, you know, it can kind of help you plan your social media, your media outreach, and stuff like that. It certainly helps us focus our media outreach and our social media activity day by day. So this year, the broad theme of National Health Center Week is celebrating America's health centers, the key to healthier communities. And so that's, you know, you use that how you want. You know, if you want to have like, you know, keys be a central part of what you're doing, or you want to like present a key to the city or do something kind of clever like that, that's awesome, but certainly it shouldn't be limiting. Really, the point is to showcase the value that health centers are bringing to the community and how they're really driving healthier communities from the ground up. And then these, you know, extra sort of specific theme days or focus days just kind of help you get a little bit more narrow. But again, they shouldn't be limiting, and certainly you can do any type of event on any day, really, of the month of August, and we would consider that to be a really successful National Health Center Week event. So just to go through these really quickly, Sunday is Elected Officials Day. We're particularly wanting to focus on state and local elected officials. I think it's a really great idea to invite them to all of your events. And we're actually going to have a template certificate on our website that you can print out. You know, if it's a mayor or a state legislator or a city council member that's always been really supportive of your health center, you know, create the certificate for them, maybe plan a ceremony to present it to them, and really, you know, make sure that their support is really showcased and appreciated publicly. We're certainly going to need it in the months to come. So, but also it's just a great way to sort of show, you know, the network that your health center has built. Monday is Health Screenings Day. That's in partnership with our national partner, the American Cancer Society. They are really looking to showcase specifically cancer screenings at health centers, but certainly there are, you know, other types of screenings and preventive medicine that you guys are involved in. So that's a great day if you want to do free screenings for something, or you know, just showcase sort of some of the preventive medicine you guys are doing. That will take place on Monday. Tuesday, Wednesday, and Thursday are our designated special population recognition days. We've had those for many years. Tuesday is Public Housing Health Centers Day, Wednesday, Healthcare for the Homeless Day, and Thursday, Farm Worker Health Day. And certainly if you don't particularly serve any of these populations, you know, no need to like not have an event or whatever you want to do. You can certainly go forward and go ahead and celebrate in your own way. Friday is Consumer Board Member Day, just kind of showcasing the model of health centers. We think it's kind of like a little known fact publicly that 51% of health center boards are made up of consumers, and we think it's a really important fact to showcase to the public and to legislators and decision makers. And then Saturday will be Children's Health Day, and that's a nice one because we typically see a lot of back to school fairs and health fairs with free physicals and fun kids events. That tends to happen usually on the Saturday of Health Center Week, so we're kind of, you know, just promoting that and showcasing that. Just a plug, we have event ideas. We're going to have media templates for each day of the week. We're going to have blog posts and shareable social media posts with fun data points and quotes and stuff like that. So check out our website, healthcenterweek.org. There's some basic information there for now, and we'll keep adding as we get closer. And Children's Health Day in particular, one of the cool event ideas we saw from another health center is to do like a kind of an open house with doctors, so the kids get to, like you see in the picture below, like wear a stethoscope and like learn how that works and kind of do, you know, get a little bit of training in it, but it's fun for the kids, and it's a good way to get your community in your doors. Okay, we could go to the next slide. So just a plug to definitely post your events. So as soon as you have something, you know, in the works, please go ahead and post it to healthcenterweek.org. You can edit it later. So, you know, if it changes, you want to add some details, you got an elected official has confirmed that he or she is going to attend, you can definitely go there and change that. But it's really helpful for us to have a sense of what's going on. Number one, because it helps us showcase what is happening across the country, you know, nationally, to be able to say to federal, you know, legislators, to the media, to corporate sponsors, you know, just how big this event is every year. So we just try to really document it as best we can. But then secondly, and probably more of an incentive for you guys, is we depend on it greatly to be able to place local sponsorships at health centers. So as you guys know, we have a number of corporate sponsors who've been generous enough to really support this Public Awareness Week. And, you know, the vast majority of that gets funneled back into the communities, to the health centers. So if you're planning something, even if it's tentative, put it online. If we have a sponsor who's interested in your region or your area, that enables us to be able to better match those sponsorships. So please definitely post your events. So the second step is go ahead and reach out to your elected officials. Again, it's not too late. I would go ahead and get that done if you want to invite your members of Congress, and I would definitely encourage it. We actually have Health Center Week every year in August because it's recess for members of Congress. And certainly this year with our, you know, various policy challenges and opportunities, we're going to want them to really be out in the community at your health center, seeing really the value that you're bringing. So go ahead and invite them. If you haven't for their scheduler or whoever your contact is in their office, reach out, you know, keep following up. Sometimes it takes them a long time to respond, and be flexible. Sometimes they'll just say, hey, I'm going to come on this date. And so sometimes you have to sort of organize or coalesce like a mini event for them. You know, I think it's definitely worthwhile if they decide they can come to your health center. And then keep it nonpartisan. You guys know this, but, you know, it can be difficult sometimes with all of the politics that are happening, and, you know, particularly if there are elections in your community and there, you know, things are getting kind of heated. You know, just keep it very, you know, focused on your health center, focused on the community, you know, staying away from campaigns and platforms and all that stuff. And usually, you know, if you do that, you'll be fine. And if you have any questions, you can always let us know. So for sponsors, like I said, we try to help match national corporate sponsors with many of you on the ground, but we also see a lot of health centers that have a ton of success in seeking sponsorships themselves, both from the community and state level sponsors. So we definitely recommend it. You know, you can be really creative about what kind of sponsorship. It doesn't necessarily have to be cash, although that's always nice. But if you can get an in-kind donation, maybe somebody can donate some snacks for your event or some giveaways that you can use. That's always helpful. And then sometimes participation can be good. You know, particularly if you can get, you know, during an election year, we see a lot of volunteers coming out to register voters, you know, or if you can just get, you know, volunteers to come out and help you like man your booths or your, you know, whatever. I've seen like pop-up slides and, you know, bouncy houses and things like that. Just getting volunteers to help out sometimes can really make your event a big success. So I would start by your description of your event. Go ahead and post that on healthcenterweek.org. Write a list of potential sponsors, you know, be creative. Anybody in the community, grocery stores, banks, insurance companies, local restaurants, anybody you kind of typically do business with is a good place to start. You know, make a contact, send a letter, you know, give them a call, you know, produce results, make good on what you propose. So if you said, hey, we're going to have hundreds of people out here, you know, try to get hundreds of people out there. As you said, you know, we're happy to show your sign at our event. Make sure you show your sign, just simple things like that. Because what you're going to want to do afterwards is follow up with a thank you letter and say, hey, look, this event was such a success. We had this many people. We provided this many screenings. Your sign was here. You know, you got 2 minutes to talk, and, you know, people seem to really enjoy it. Just making sure they know it was successful so they'll come back next year. And one of the best pieces of advice, I think, is send that same letter essentially to the sponsors that said no. You know, asking them to reconsider the next year, because that way they can see, oh, there's evidence right here in front of me of how successful it was, and kind of let them know, you know, what they missed out on. So the next piece that I think is so critical about National Health Center Week is spreading the word and really getting online. I think we have a huge online presence during Health Center Week because, you know, people are just really active using our hashtag NHCW17 and showcasing all the awesome stuff that's going on. It's just good photos, good quotes, good data points, good stuff to share. So just get online, definitely use those hashtags NHCW17 and value CHCs. We have some sample posts on our website. If you're like, I don't know what to say, like, feel free to use our forum posts. And then definitely reach out to the media, you know, make sure you invite them. It's extended invitation, particularly if you have elected officials, that tends to be a really big draw for them. And then we also have some media templates, letter to the editor, op-ed, something else. And anyway, we really recommend you use that, but personalize it and, you know, add your own flair, add your own personal story, add an anecdote about your community, and submit that to local papers and TV, radio, whatever fits for you. But that's just a really great way to get the word out in the community. It really creates this echo chamber around that week. And we've noticed elected officials tend to really look at that those local media outlets. So it's a great way to connect with them as well. And then finally, you know, just keep up the momentum. Health Center Week is awesome, but for us, you know, we plan for continuing through mid to end of September because there's all this extra momentum that lasts. You know, first of all, like I said, you know, you guys know, always say thank you to attendees, sponsors, media, elected officials, and let people know how your events went. And then the biggest thing, I think, is the contest. We really hope you guys will participate. Every year we have a picture and a video contest for National Health Center Week. So we solicit pictures and videos from you all at health centers the whole month of August. You can enter one per person, but your health center could enter, you know, however many you wanted. And then, you know, we'll pick the finalists, I think that first week in September, and then it's just a grassroots voting process on the finalists from there in mid-September. So it's really fun, particularly if you're chosen as a finalist, to get like all your community behind you, all your staff voting, just get as many votes as possible. It's a good, fun, easy way to engage the community and promote your health center, build some morale. And it's hopefully, you know, the photo and the video are things that you can use in your promotional materials going forward. We always hope that, and we certainly use them, you know, on social media and our website and all that stuff as well. So it's just a great, fun way to continue the momentum beyond the actual Health Center Week. And let's see. So final plug to post your events, but then I'm happy to take questions, but what I will say is there's a lot more information to come. So I think, you know, right now we have a lot of advocacy alerts that we're pushing out through NAC and the Health Center Advocacy Network, and you know, we're facing a funding cliff coming up at the end of September, and there's just a lot going on in healthcare. So depending on where things are at around Health Center Week, that's going to help shape sort of our talking points that we'll give you. I will say we always are promoting, you know, just the value that you guys bring to the community at the local level is so critical, and I think it's always going to be your best approach for talking to elected officials and talking to the media. But like I said, as we get closer to that date, you'll probably see some more specific talking points, briefs, or information, you know, that you might want to have in your back pocket as you're doing this Health Center Week celebration. So But yeah, I'm happy to take any questions.
Awesome. Thank you so much, Alex. So
Thank you.
that's a lot of cool information, and we're really excited that NAC has all this resources and stuff for us to access. And I know Alex is a really good resource as well. And then again, as we get closer to National Health Center Week, I think it'll be a little bit more obvious or clear what some focus will be, because there's a lot of stuff, of course, going on right now with health center funding and just healthcare funding in general. So again, going into that month, hopefully, or that week, we'll have some more clarity. So definitely either pop your questions in the question box, ask us questions in the chat, or jot down Alex's email, or you can also email policy@appshow.org and we can pass it on. Thank you so much, Alex.
Thank you.
Thanks. Okay, we're gonna move on, but definitely you can still put your questions in the question box in the chat box. We can also do questions at the end. So moving on, the next sponsors are pretty great too. So again, NAC has so many great sponsors. So if you want to make sure out in the field that those are connected to your health center, definitely put your information in. Right now, I'm going to pass it to Kathy Fan. Kathy, you're on. Yeah.
Hi, everybody. This is Kathy from Whohook Clinic in Houston, Texas. So I will be talking to you today more about staff engagement and how to really get your staff involved in National Health Center Week. Next slide, please. So just a little bit of background of who Whohook Clinic is, so you can see whether or not you can mimic this at your health center. We were established in 2002 by the Asian American Health Coalition, and in 2012 became a federally qualified health center. Today, we actually have 3 locations in the Southwest Houston area, and we see over 47,000 patient visits a year. Of course, we accept anyone with and without health insurance, and regardless of their immigration status. So we always try to promote that to make sure the community knows that we're there and can build that trust. Next slide. So in-house, what makes us a little bit more unique is that we actually speak over 28 different languages, and throughout the year, we serve over 70 different ethnicities. So many of our languages include English, Spanish, Mandarin, Cantonese, Vietnamese, Burmese, and Arabic. That being said, a lot of our materials we try to translate and accommodate in these different languages so that we can really reach out to the different ethnic populations that we serve. Next slide. So some of our services, we have our primary care services, women's health, pediatric, OBGYN, we do our immunizations, and we have a registered dietitian that will do nutrition consult. We, of course, have case managers that will help with referrals. We also have our behavioral health center. So we're trying to do more of a one-stop shop. We also have dental and vision in our clinics. And for all these services, for those who don't have health insurance, we put them on a sliding scale fee based on their family household income size. Next slide. So a little bit about the programs, and hopefully you'll see why I added this piece into here as we talk more about Health Center Week. One of the programs that we have is called the Phoenix Project. That's our breast cancer awareness. So we'll go out in the community and educate and talk to women about screening and treatment, and we also have funding for those who may qualify. So we definitely try to make sure and raise awareness about breast cancer. And then we also have something called our Papalooza, where we provide reduced price pap smears for those who qualify. This is really to raise cervical cancer awareness, especially in our Vietnamese population. There's a higher risk for our Vietnamese population to have cervical cancer, and many of them who don't have health insurance don't have access to healthcare. So we really try to focus on this population and get them in to be screened. One of our newer initiatives is called our Nail Interactive Teaching. And this is where we'll go into nail salon shops to educate them on worker safety, breast and cervical cancer, and then talk to them about different social determinants of health, including, chemical safety or ergonomics, and even just things about the OSHA regulations and worker rights. So we use it as an opportunity to build that relationship with them and then build them up as champions so they can talk to their customers about safety and health as well. Our CRC program is our colorectal cancer initiative. That's where we'll go into the different exam rooms after the patient has been triaged, and we'll go and talk to them and educate about colorectal cancer to really help improve our screening rates and raise that awareness and try and help to get over that stigma of colorectal screening. So we'll work with the providers and let them know who we've talked to and educated and help answer any questions, and then kind of do this warm handoff to the providers so that they can talk even more about it, answer any questions that patients may have, and then really be able to follow up with the patient on whether or not they've turned in the test, the FOBT test, the FIT test. So we'll follow up with them, answer any questions they have, and then do a phone call reminder if they haven't, and then follow and give them the results once we get them in. Next slide, please. So our National Health Center Week, what we like to do is we like to take many of our existing programs and really promote it to a whole nother level for our National Health Center Week. So very similar to what NAC is promoting, we do something called our Spirit Week for National Health Center Week. So every day we have a theme. We do try to mimic off of what NAC has on their website, but then to try and engage staff more, we let our staff give input of topics that they feel are important to them, because we hire many of our staff from the community. They know the health issues of the community that they're from. We really want their input. So here are some of the examples that we've had for our flyers. We'll do a different theme each day, and what we'll have the staff do is dress up in different costumes or outfits that represents that theme, and then be able to use it as an opportunity to educate and engage our patients. So for example, a couple of years ago, we had summer bike safety. That was one of the staff that lives around the area, noticing that many of the students or many of the kids there who they love to ride bikes, but never wore any helmets or elbow pads. And so staff would wear, sunglasses and helmets to raise that awareness to kids and even parents and let them know why it's so important to bike with helmets. We did Superhero Tuesday, where we'll dress up as our favorite superhero or a make-believe superhero to fight against whatever disease. Wacky Wednesday was to stomp out smoking and bring that attention to smoking cessation. We did a Dress to Impress, which was about honoring different cultures and bringing that awareness that health is important to everyone, not one specific culture. And then, of course, one of the things that we always keep is our Red, White, and Blue Day, and that's really to engage our staff and our patients to be civically engaged. So, and then last year, what we did was we had a whole event where we invited different elected officials to come out. We really had the staff do a dance-off, actually, for each of the days. And for one of the events, we had free ice cream and had a whole community event for patients. And they could come and we would register them to vote. And having the elected officials out there gave them an opportunity to be able to meet their constituents and have the patients understand who their elected officials were and really be able to interact with them. So that's what you'll see on the top right-hand corner, where we have our Make Your Vote screen with some free ice cream. We brought out Kona Ice and gave free snow cones to them. And of course, we always want to say thank you to everyone who has been supportive of our events, whether it's sponsors, patients who have contributed, elected officials, or volunteers, or even our staff. So we made a little thank you card you see on the bottom right-hand corner, especially for those we called our Super Civic Champions. Those are the staff members who would wear the buttons that help people to register to vote, or as part of the eligibility process, ask them to register to vote. So using that as an opportunity to really engage patients civically. Next slide, please. So some of the barriers that we've had because sometimes staff engagement isn't the easiest thing. Many staff didn't really want to participate in the previous years. They may not have been aware of it. So we really wanted this to be something that they could truly own and feel a part of. So with our Spirit Week, it was something that was simple. People could dress up and it wouldn't get in the way of their work, but it really got them to be excited, especially when they get to pick and choose the days that they thought were important to them. It doesn't really create an extra task for staff members. Sometimes when we do health fairs or something, we're pulling them away from their task, but this was a great opportunity that they could continue to do what they were doing, but then just really go and have fun with it. And it was a great way to educate patients. Patients would come in and see all of our front desks having crazy hairdos and ask like what's going on, and it was fun to get the patients to be involved, and then they would go and tell their friends. And so the staff would also vote on the days that they wanted to have to contribute, and then we would do a contest to really get them even more engaged. Friendly competition is always a fun and great way to get people more involved, so we'll do an individual and a department prize. Those with the most creativity would get like a small prize or recognition. So we'll have staff actually take pictures and send it in, and then everyone would be able to vote at the end of the day. And then we would actually do a dance contest to kick off National Health Center Week. Each team got to pick each department got to pick a day to represent, and they would choose their own song and then do like a 30-second dance off, just to really get everyone pumped and ready and excited for National Health Center Week. Next slide, please. So these were just some of the events that we had. As you can see, we love taking the pictures. This was our Wednesday Superhero Day. So we had different departments dress up and take pictures, and you can see it was easy because you can keep it work appropriate. So when staff are talking to patient, it's still professional, but still fun in the sense that they get to still bring a little bit of individuality and a piece of themselves. Next slide, please. Another one that we had was our Outsmart Smoking Day. So everybody got to dress up as nerds and just too cool and too smart to smoke. So these are just some of the pictures of our different sites and different departments. Next slide, please. So one of the days that we never change is our Civic Engagement Day. We want to make sure that while other issues may change, one of the root things that we always keep is is red, white, and blue. So that is when a lot of times we'll invite different elected officials to come out. We'll talk to the staff and use that as an opportunity to educate them why it's important to vote, especially in local elections. So having the staff members understand the importance of voting and the importance of talking to their congressmen or senators can really help them to relate to the patients that they are working with. Next slide. So alongside engaging staff members, we also want to engage our elected officials. So of course, Alex already talked a little bit about this, so I'll skim through it. It's important to let them know ahead of time because they are very busy, especially when they're back in their district. Everybody's trying to get them to come out. So the earlier that you have a week planned or an event planned and you can talk to them, the easier it is and the higher chance that they'll come out to you. We also love to invite them to come out for a tour of the clinic and then to get to know their constituents. Elected officials really want to know what's going on in the community. And as a health center, you have a collective audience and right there. So it's a great opportunity for them to be able to meet the people in the community as well. And then we always want to appreciate our elected officials for their support. So we'll have a certificate of appreciation. We do use the NAC resources, so it's been very helpful to have those tools. And then it really encourages the elected officials to come out and just be more engaged to have an event to participate in. And then, of course, even though the member may not be available, you don't want to just give up. We always want to ask for a representative from their office, a staffer or anyone else, so that you can continue to build that relationship. You know, regardless of who it is, you know, you still want to extend that same courtesy. And many times building that relationship with the staffer can really get you more face time with the member later on. Next slide, please. So it's great to get everyone involved. We had a little photo booth for the patients, but we also really encourage the elected officials to come out and join us with it too. I mean, they're also human. They love to have fun. So it's a great opportunity to get them involved and really see the work that you're doing in the community. Next slide, please. So just as some final tips, you always want to start planning early and remind people. Alex again mentioned this, even though if you haven't started yet, it's still not too late to get everything together, but just the earlier you have things in place, the easier it is for everyone. It helps our vendors or guests to get together, and it really just overall makes it easier for everybody to just block out their schedules. It's great to incorporate other existing programs that you may have, just like the programs that we talked about. A lot of times we'll use a certain day to promote one of those programs, and let our patients know that we have these resources for them. Involving staff opinion and their ideas is really one of the best ways to get your staff to be more involved. It's really easy for a coordinator or for you to plan it and say, okay, this is what we're going to do, but it's going to be harder to get buy-in unless they feel like they're a part of it. So really taking them into their opinions into consideration makes a huge difference. And don't let any opportunities pass you by. You know, this is a great time to really start registering your patients, your community to vote, to talk to them about what's going on. Patients may not be as aware of issues like you are, but this could be a great opportunity to bring everyone together, maybe have a workshop or just different tips about how to talk to your elected officials. And lastly, be excited. If you as a staff member aren't excited, it's very hard to get other staff members excited, engaged, or even patients. So when they see how excited you are and the passion that you have, it's contagious. So really just put your heart into it. It is really great that we have this week, and we really want to show our patients, our community, elected officials, and staff the importance it is of having a community health center. So just be excited and have fun with it. Next slide. So if you have any questions, please feel free to reach out to myself or Leslie Cordova. She's our outreach specialist, and will be helping us organize our National Health Center Week this year. Thank you.
Awesome. Thank you so much, Kathy. So we really love seeing all these like pictures of staff being excited. It really kind of shows how excited people are to like dress up for work stuff and then put a lot of energy towards that. And we know that has like an amplifying effect for patients and things like that. So really exciting. And thank you so much. So if folks have questions for Kathy or Leslie, definitely either write down their emails. We have again a question box in the chat box. So either now or towards the end, we can address any questions and things like that. So I'm going to move us on to the next person, which is John from Asian Health Services. And he's going to be talking about social media advocacy and some of the really cool stuff that they've been able to do. So John, are you on?
I am. Thank you, Heather.
Awesome. Yeah.
Okay. Yeah, so I will definitely be talking about social media advocacy and a little bit of our focus last year. So I work at Asian Health Services. We're in Oakland, California, also a federally qualified health center, serving numerous immigrant communities. We have staff that speak over 12 different languages. And I'm going to focus very heavily on a particular social media effort that we did last year. So go ahead and go to the next slide. So for last year, what we decided to focus on was media heavy work instead of bringing in people to our clinic or doing larger events, particularly because there were many other things going on that week, like the API presidential town hall in Las Vegas, and we had a lot of staff that were going to that. So we focused on advocacy through media. So we had one of our providers write an op-ed. We sent that out. It wasn't picked up by too many media sites, but we did at least generate a conversation with New American Media, someone from New American Media. We also wanted to share information about the API health statistics in tweets, both local and national. We figured it would be a great way to connect our issues, or the issues that our communities were experiencing on a national stage, like National Health Center Week. And civic engagement and voter registration were a big piece last year because of the election and also just the general value that we have at Asian Health Services. We also did health education and outreach through media. We shared information about Asian Health Services, some facts, some of our impact, some of the kind of the languages that we speak, just basically trying to get a little bit of marketing out about Asian Health Services, and not so much just to tout ourselves, but to show the need in the community. We also highlighted our dental program and our fundraising efforts, because this year we're going to be opening up our expanded dental clinic, which is great because we have a really long wait list, and it's a big issue that our community needs, of the community's need. And it's also going to have a behavioral health office. So connecting the dental health with mental health, it's a really great opportunity for us. And then we also did a lot of social media focused things, like live tweeting the API presidential town hall, which was that Friday of that week, and doing a tweet chat called API Health Matters with our friends at Appeal. And that's what I'm going to focus on today. Go ahead, next slide. I wanted to post this just in general as a guide if you wanted to do more social media for that week. I believe social media calendars are really important, and it helps us really make the work that we do pretty intentional. So you'll see this is the week starting on Sunday. I didn't include Saturday on here just because it was going to be too big of a picture, and I wanted to be able to see some of the things. I wanted you to be able to see some of the things that we noted down in the boxes. But when it says TW, that's Twitter, and when it says FB, it's Facebook. We focus primarily on Facebook and Twitter for our posts. And this way we could plan out what we're going to do. We could schedule it, especially if we don't have too much time. We're not necessarily going to be on Facebook at 1 o'clock, but we could pre-schedule it. We could pre-schedule tweets, etc. And you'll see on that Friday, we have our tweet chat announcement. The tweet chat is during that time, and also some reservation times to announce some of our events. So I just wanted to share that. Go ahead, next slide. Okay, so what the bulk is I'm going to talk about is the API Health Matters tweet chat. If you've ever been on a tweet chat, essentially what it is a conversation that's done on Twitter. Usually it's an hour, and it's done in a Q question and answer format. And our goal last year was to bring light to Asian American Pacific Islander health issues. So we did it on that Friday, August 12th. As you can see, it was during lunchtime here on the West Coast. And we did it strategically at this time because we wanted it to be kind of a transition into live tweeting and bringing more attention to the API Town Hall, which is happening that afternoon and that evening. And as discussed earlier, it's a great opportunity to bring local issues on a national stage. With hashtags, we could connect to the National Health Center Week streams. We can connect to the API Presidential Town Hall streams. So even if we're talking about something very specific in Oakland or something very specific in Long Beach, someone from Florida, someone from Minnesota can see it and see if they could agree that's happening in their communities or add to the dialogue about the issues that our communities are facing. Okay, go ahead. Next. All right, so some planning pointers for a tweet chat. I talked about some logistics like topic, time, and title, and audience, and this is really important because we need to know who we're going to reach out to and when would be the best times to do it. As I mentioned, we did it during lunchtime here in the West Coast, and primarily it's because Appeal is also based out here in the West Coast, and we wanted it to also flow into the API Town Hall, which was happening that afternoon. And the topic was very specific. We wanted to talk about API health issues because we wanted anyone that happened to be jumping on for National Health Center Week or for the Town Hall to see all the different diversity of needs and strengths that our communities have across the country. So if you're planning to do one, think about the times where you think staff of organizations that you want to reach out to can do it. If you're thinking heavily on the East Coast, then you might want to do something at lunchtime during that time, or something maybe somewhere in between to allow for the rest of the folks from Central and Pacific time to jump on. A big piece is also choosing the co-hosting partners, and that goes along with the audience. If you have a strong social media presence and you have your network, that's great. What you could think about for a partner is someone who is similar in terms of topic, but also can expand the audience to read and see what issues are happening. So as an example, let's say you're working on, or you want to do a tweet chat around API health, particularly with seniors. Maybe one partner could be AARP because they have such a expanded network. Deciding on and testing out your hashtag. Last year we chose API Health Matters and I checked it out. Sometimes when we do events and we try to use social media as a rallying tool, I've seen hashtags that were great and I checked on them and also happened to coincide with other topics that might not necessarily vibe or connect with what you're talking about. So this picture on the right side is just examples I made earlier today, or earlier this week. So imagine if our tweet chat was titled Asia Pacific Islander Electronic Charts tweet chat. Some people might be really interested in that. And the hashtag is API eChart. If you see on the bottom, it also says a pie chart. And then the topic is what caused most problems in Greek mythology. It's a little bit humorous. But if you look at the topics underneath that graph, some of it might not be necessarily most appropriate, and some people might find that offensive or whatever the case is. So we definitely want to make sure that when we pick a hashtag, you go on Twitter, search it, and make sure that it's not necessarily being used by anyone else or might be misconstrued with something else. And the other things is preparing your questions and preparing your answers early, in preparing your partners, obviously, with their answers. And remember that the limitation with tweets is that there's only 140 characters that you could use, and that includes your Twitter handle, any hashtags you want to use, so you have to be pretty efficient with the answers, and then publicizing the tweet chat. Go ahead to the next slide. And so what happens during the chat? Whoever the organizers and co-hosts are that's running the chat, they should definitely be on the phone because with the multiple eyes, you won't necessarily know if certain people aren't using the hashtag, if not responding directly to you. There might be more participants that are participating that you might recognize. And so even just being on a conference call, it's typically pretty silent when you're doing a tweet chat, but at least someone can say, oh, there's really interesting a tweet by this particular person or this organization, or there's a tweet that is challenging someone's idea. Has anyone else seen it? So that's important to be all in communication with each other during the tweet chat. All co-hosts should be engaging the participants through retweets, replies, likes, and questions. And here, as an example on here, you can see that there's responses and replies, and on the bottom, Appeal replied to one of the questions, and then our youth program staff responded and added to the dialogue with Appeal, which is important because that's part of the social media, is that it's social. A suggestion is to open multiple tabs, having the co-host profile to see who's sharing or replying to what, in case you want to jump in on some of those side conversations, and also having a tab open on your browser with the hashtag, again, just in case some people are responding or participating but aren't necessarily responding directly to your account. For the partners that you know are going to be participating, it would be great to, for this one, at the beginning of the tweet chat, providing instructions early in the tweet chat, basically it's laying the groundwork of how people are going to respond. So if you notice, one of them says Q4, so that's question 4. You ask the question with the hashtag, and you could add any of the hashtags that are particular to this particular question, and asking people to respond back to you using A and the number, so answer to what question, and including the hashtags, just so that it can all be gathered into the streams for either the hashtags or the timeline. And then, as a courtesy, I suggest that before you participate in any tweet chat, you warn your followers about an increase in tweets, because sometimes they may be following you and you may tweet 5 times a day, and then within that hour you might be tweeting 25, 30 times. And so for some folks that might be particularly troublesome. And so letting people know beforehand that you are going to be participating in tweet chat is a good courtesy. And of course, thanking your participants. I didn't show it here, but the common practice is just to find everyone that participated, whether it's a reply or a retweet, and just having multiple tweets that have their Twitter handles on it, and just thanking them for participating. Go ahead, next slide. And so a summary and learning. So this shows the thank yous on here. Having at least 2 staff is tremendously beneficial, because one person might be doing the tweeting and someone else could be scanning the hashtag in the streams. Understanding your key audience, key partners, and their schedules. Again, figuring out who it is that you really, really want to engage in the tweet chat. It might not be everybody, and so if you know who it is that you want to engage, whether it's elected officials or other organizations that are working on similar issues as you, knowing when to time it and how to engage with them beforehand. Think of partners that are relevant to your message and also can add to the network of participants, which I mentioned as an example with AARP if you're working on something on API elders. Preparing your answers early, including any links to data or key information. So this is a great opportunity for you to link up any of your research articles or infographics or some of the great graphics that Kathy showed for National Health Center Week that they've used. This is a good way to use that content that you already have and bringing it to a potentially new audience. And then keeping connected with the participants, just like Alex mentioned earlier. If you generated some media and some kind of attention, hopefully there's new people within your networks now, and it'd be best to continue to build that relationship with them. And then, as common for most tweet chats or hashtags, you could use a program called Storyfy, which basically can pull up all the tweets under that particular hashtag, and you have an opportunity to rearrange them, edit, erase ones that are offline or just don't seem to fit the chat. And then you could save it and then send it out numerous ways through Twitter, Facebook, LinkedIn, other sites, or email it out to other supporters. And so the other thing I talk about with the timing is that last year we thought it would be a great idea to do a tweet chat before the API town hall, which was a great idea. But the issue was that many of the partners that Appeal had, and actually also that many of the partners that AppShow has, were already at Las Vegas, so they really couldn't participate in the tweet chat because there's so many different things going on that day. So while strategically we were definitely on point, functionally it became a little bit of a challenge. So we didn't have as many of the people who we knew would have been interested in participating in tweet chat couldn't join. So that's one of our learning lessons from last year I wanted to share with you. And I think that's it.
Awesome. Thanks, everybody. That was, I think, John, that was really, really cool. We know that the tweet chat is really exciting, and it's a really exciting way of getting all these different other groups to kind of talk and verbalize more. Things like API Health Matters, using different media. And also, I know so many of our organizations have data or key information that we've put together in the past year or past years. And so it's really nice to have stuff that can link back to that and refer back to that. So it's really cool. So thank you so much. I'm opening the floor up if there are any questions. I know we're getting close to the hour. So Alex had to jump off, but really quickly, just for both Kathy and John, I'm wondering if you guys can tell me, for any health centers listening in, just really quickly, what sort of a next step they could take if they wanted to do a similar activity to what you guys did? Like, what's the first step that they could do?
This is Kathy, and I think one of the first steps is really to get the buy-in of your team members, of staff, and of upper management, because when you can have their support, getting everyone together and on the same page makes it a lot easier, whether you want to do a tweet chat or do a spirit week or whatever it may be. Having everyone on board is really the key.
Yeah, I would echo that, and also, I would also add figuring out what it is that the goal or the impact that you want with the event, and because that will help you decide who to engage as partners and who to engage as elected officials, even if it is an hour-long tweet chat.
Very cool. Yeah, so those are some really good next steps, like kind of getting your internal stakeholders and external stakeholders in goal setting, or kind of what's the kind of thing to focus on for National Health Center Week. Well, awesome. Thank you guys so much. I want to thank everybody who joined us on the phone, who presented. This was really useful. And again, if folks have questions, we also are available at policy@appshow.org. And so any of the things we can also iron out. And yeah, go forth to National Health Center Week. Thanks, everybody.
Okay, thank you.
Thank you.
Thank you.